What's going on, folks? Ray Anchor from Educators Podcast, and I got the distinct honor and pleasure of being able to talk today with one of my good friends, Dr. Ono Iwarie. Doc, how you feeling, man?
Man, I'm feeling good, man. I'm glad we're doing this. So I'm feeling great.
Yeah. And so today, folks, we're going to talk to you about stereotype threat, right? And uh, we're gonna position it in a way or fashion it in a way in which we can cover multiple things in terms of how we talk about stereotype threat. And so Doc, if you are given a working definition of what stereotype threat is, what would you say it is?
So the easiest definition would be stereotype threat is the increased anxiety and stress that's caused from fear of confirming negative stereotypes about your group. So that's the boilerplate quick answer.
Yeah. So love that, right? So like, we talking everything black, right? And so and so talking everything black, doing it in black, even though I'm in blue, but it looks like it's black on the screen, but whatever. So so when you think of like the stereotypes that let's say African American males, like what are some of the stereotypes that African American males face in American society, in Western society?
So actually, the biggest one that impacts us really is intelligence, right?
Okay.
So
Okay.
the thought that we're like less intelligent, less educated, etc. So, like for example, all right. So you've been in situations where you're like the only one in the room, right?
Yeah.
All right. So when you're in there, when you're the only one in the room, do you find yourself being more thoughtful about how you say things?
Absolutely. 100%.
And part of that is because you don't want to confirm negative stereotypes, threats. Negative stereotypes. You don't want to confirm negative images about your group, right? So you're like, okay, I'm going to say it a certain way, or I'm going to do
Yeah.
this because I don't want anyone to question my intelligence because I know as a black person, they question my intelligence, right?
Well, to some degree, yes. But then in other respects, I think I look at it more so like I'm not caring. I'm a black male, but I'm not every black male. Like we're not, like I'm not. I'm not putting the race on my back in terms of being the only person that's in this room that's representing or like that is African American male, right? So
Right.
like I think I do a really good job of like front loading and like differentiating the fact that, hey, listen, although I am a black male, I do not speak for every black male. I speak for me,
Right.
right?
But when you do speak, though, right?
Yeah, yeah.
Does part of you want to make sure that you are presented a certain way so no one questions that? So, like, if the person
Sometimes for the
sometimes,
first for the first well, let me say this. Let me clarify. For the first part of my career, yes,
right?
right? Because like even though you have like all of the fancy book work and stuff like that, and you have the experience and stuff, yeah, like there are some things that it's like you don't want to trip over your words. You don't want somebody else to be able to say, all right, I don't even know if this person is smart enough to be in this position or whatnot. So yes, I used to be very,
Yeah.
very casual in terms of like preventing that causation. Yes. So yes.
And then over time that passed, you got more experience in your career, et cetera, et cetera. But one, you have experienced it before.
Yeah.
So when we experience it, so a lot of times when I talk to people and they say they experienced that, I
Yeah.
ask them, I'm like, all right, so when you were more cautious about your words, did you find that you actually would fumble your words sometimes, or you would
Mm,
misspeak or missay something?
mm,
And normally you would have said it fine, but because you're trying to not misspeak and you're monitoring your words more, you end up like messing up a little bit or
yeah.
second guessing yourself. Or a lot of times with students, they won't raise their hand at all or they won't say anything at all because they're so worried that they don't know the answer that they don't want to confirm negative beliefs about them or their group.
Oh wow.
That's
That is
stereotype.
that is so bro. That is so powerful, right? Because that's powerful from like from a K-16 lens, right? Because like you see that in K-12, of course you see that, but then also and we be remiss to not say that you don't see that in higher ed as well. Like you see that in higher ed. Like I remember like experiencing those types of things or whatever. Like I remember a class at SUNY Albany, my black religion class. It was black religion class taught by a black doctor, and like you had a class full of black black people in that class, and I would be real cautious in terms of speaking out because I didn't want anybody black to not think that I wasn't like smart enough and whatnot. So
Exactly. So you avoid the actual activity. And then when you
yeah,
do it, because you're nervous, you may not be as smooth as you normally would be. Right.
yeah, yeah. Yeah.
That's a real easy version of stereotype threat. But
Okay.
another way is, so research shows that, like, you know how like back in the day you would take the when you take like SAT, ACT, whatever. Remember
Mm,
how the demographic information used to be at the beginning of the exam?
yeah. Yep.
Just having the demographic information at the beginning of the exam has proven to decrease the performance of people with negative stereotypes around intelligence. It decreases it by up to a full standard deviation statistically. So it's a pretty significant gap.
Wow. So you're
Just
saying to me by students coming in and taking the ACT or the SAT, them filling out the demographic information alone in the beginning of that test makes them fall within a standard deviation downward
yes.
of how they perform on the test.
Yeah, that's the reason
Well,
why. So if like modern people take it, like modern people nowadays, when people take that
yeah,
test, right,
yeah,
they
yeah,
actually don't do it at the time of the test. When you request to take the test, they take
yeah,
the demographic information then, because the research shows that if you do it at the time of the test,
yeah.
it triggers it,
Oh
right?
wow.
And
Yeah,
matter of fact, it used to be so. It definitely happens to Black and Latinos people now, right?
yeah.
It also used to happen with women in STEM. So they did so they looked at the AP course, for example, right?
Yeah.
So AP used to, and this is how crazy it is. They actually, this is AP study. They did their
Okay.
own study on this, right? So for AP physics exam, right? They did an experiment where to see the difference in how the performance was if the demographic information was at the beginning or if the demographic information was at the end. So when you put it at the beginning, males outperformed females in the test, right?
Okay. Yeah.
But when you put it at the end, the females actually, their scores went up and male scores went down because they weren't reminded of their maleness. Male scores went down, female scores went up. Females actually outperformed males when you put the demographic information at the end. So when
Wow.
they discovered this, the test people say, you know what, we're not going to make any changes, even though we know women are underperforming. We're going to
Of
keep it
course not.
consistent because we don't want to mess
Yeah.
with anything. Once they found out that dude scores would actually drop, right?
Yeah.
So it took years before they addressed this. So Aronson, who's one of the like leading researchers on this topic,
Yeah.
he estimates about 7,000 female students per year should have received AP credit that did not, because they did not pass the test because of stereotype threat. So that's 7,000 women per year who would have not had to repeat the class in college, who would have qualified for classes that was a prereq, so they would have been further along. And usually if you're doing AP
It's
physics,
free. It's
yeah,
free. But then also you got to talk about the financial aspect of that as well, right? It's
yeah,
like if you coming in class with if you coming into college with 3 credits, 6 credits, 9 credits,
right,
you're already a semester ahead of people that are coming in, and
exactly.
you're saving money. Like there's the cost and savings of that, right? Because
Yeah.
like we don't talk about how expensive college is because we know that college is hella expensive, and then two, it's like if you're able to get that credit, but also you're taking bio at a R1, right? It's probably going to be in
Wait,
a lecture center. If you're taking biology at a R1 university, right, a
right.
research one university, it's probably going to be in a lecture center, right?
Yep.
So you're taking bio in a lecture center, and this is a stereotype as well, but I've experienced this, so I feel comfortable with saying it. You're taking it more than likely with someone that does not that English is not their first language, right? There's been
Exactly.
instances in which that, and we don't talk about how that impacts the learning as well. When you now have to like really concentrate on understanding a person, and then also concentrate on understanding the content as well, right? Because it's two totally
Exactly.
different things.
And then on top of that, and then you're also a member of a group that's believed not to do well in this area,
Yes. Yeah.
right? So I don't know if you remember the book. I'm telling my age, but I don't know if you remember the book, The Bell Curve, that came out in the
Yeah,
late
of
90s.
course.
Okay,
Yeah,
piece of trash. Nobody should ever buy this book. But
yeah. Matt,
so
bro, that was that book that you're talking, the bell curve. I think in I forget whose class in the African Studies department at SUNY Albany was a text you had to purchase.
yeah, I refused to purchase it. I was like, I'm not buying the book. I don't care. So I refused because I wasn't giving them money. I had
Whose
read the
class was
book.
that? Was that Levesque's class?
I don't remember.
My bad. I don't want to call him out if that wasn't his class, but I think it was.
I barely remember
And we
undergrad.
both doctors now, so
Yeah. But the thing is this, right? So that book, right, says that it basically goes into IQ scores, and it shows Black Latinos have one standard deviation below, Asians have one deviation above Caucasians. And they use that to justify like calling for the elimination of set asides and affirmative action, yada, 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 yada. All of that is explained away by StereoType Threat. It is actually, when I was working at a high rank PWI, and one of the students used that book as a reference, and me trying to figure out the answer. Like, they used that book to reference in an op-ed piece, and when people responded to the op-ed piece, nobody questioned the actual data. Going down a research rabbit hole on that is what led to me eventually getting my PhD, because I ended up doing so much research. I'm like, I need to learn more about this. So with that being said, the IQ exam, for example, even if you get a nonverbal IQ score, Black and Latinos usually are one standard deviation below Caucasians. If you give, let's say you give a nonverbal IQ score. If you tell Black people that this is a game, so like, where you move the shapes and puzzles around, yeah, you tell them that it's a game. You don't tell them that it's an IQ test. They get the exact same scores as Caucasians when you control for other factors. When you tell them it's an IQ test, they do one standard deviation below, just by saying that.
Wow. That's powerful, bro. This is powerful information. And so now you've taken up the task of kind of kicking this up a notch, and you've done some research with regards to social work and like how the social work entrance exams or the exams to become social workers also have StereoType Threat that are associated with them. Talk to us about that. Like, what are you seeing in the field?
So basically, in the field of social work, and you see this, you also see this in counseling. You see this because one of my degrees is in social work, but the other one's in counseling. You see the same thing in counseling. You see the same thing in pretty much any field that has a professional exam. You'll see that Black and Latinos across the board underperform on the exams, right? And when ABSW released the that's the people who do the test. They released the data on the social work exam, and Caucasians were passing at an 80% rate, and each ethnic group was passing worse, with African Americans being at the bottom, passing like slightly under 50%, right? So like less than half of the people taking the test were passing the first time, right? But what you found is when you controlled for other factors, so when you control for socioeconomics, when you control for preparation, when you control for all the other factors, right? The racial gap disappeared for all the other ethnicities except for African Americans. But what determined African Americans' underperformance was how diverse their workplace was, or their area, their field that they were working in. So if they worked in places that had high representation, if they worked in places that had high, what's what I'm looking for, had high, like there were a lot of Black people in their area, right? They performed better. But if you worked in a place where you were underrepresented, you perform much worse, falling into, your chance of passing the first time was much smaller. So, and that's not just social work. You see that across the board. Like if
Right.
it's an exam, you see it ACT, SATs, you see the same thing. MCAT. So one of the things that I do each year, I do a stereotype threat presentation for an MCAT prep course. And the reason why I do that is to help people do better on the MCAT, understanding the reason why we're underperforming on the MCAT is because of stereotype threat. So you see it across the board, not even just social work. Like anything that has an exam, you're going to find the same thing. And actually, Aronson, he's one of the main researchers in this field. Aronson estimates that 40% of the GPA gap in higher education can be attributed to stereotype threat. And like people will always ask, well, why do people who attend HBCUs, why do they do better academically? Why do they have higher career aspirations? Why are they more likely to get graduate degrees? Why are they, why do they have better psychosocial adjustment? And the reason why is critical mass is a protective factor. That's one of the reasons, but critical mass is a protective factor from stereotype threat.
Wow. Well, that's powerful. So what are you saying to the pundits that may be like, oh, y'all just don't study hard enough, and you're not prepared for the exam because like you just don't you don't know how to properly prepare for the exam, and I say that because with these teacher education exams, right? There's a certain way that you need to approach them, and so having graded them, right? I see how things are normed in terms of like what scores are accepted and what responses are accepted, right? And so anybody that's taking a teacher entrance exam, I always tell them, and this may sound crazy, but I always say, write like you're a white woman.
Yes. People say the same thing in my field. Like
Yeah.
act like, yeah.
Yeah,
So
you got to write like you're a white woman, especially with ETS testing, and so
well, so
yeah, go ahead.
yeah, so anything that has essays in it is going to be a little different. It's going to be subjective. So you might get the stereotype threat, but you're also going to have some bias cooked into the test based on the people writing and scoring the test, right?
Yeah. Yep.
But so I'm looking more at like multiple choice tests.
Okay, fair enough.
Yeah, so if you look at multiple choice tests, you're going to see a gap. But so people will say, well, it's still preparation or you're not studying enough. But even when you control for hours, for time on task, even when you control for quality, when you control for all the other factors. So if you take a low income Caucasian male and a low income African-American male who study the same amount of time and graduate from the same program, you are going to see a gap, right? Even if you can't prepare for, like nonverbal IQ scores, there's no preparation for that. You are going to see a gap, right? So when people say, oh, well, it's this, they're not studying hard enough, they're not taking it seriously, I'm like, let's look at the data. So for this subject is one of the most researched topics in social psychology. By 2016, there was over 300 published studies on this topic.
Wow. Not you dropping the stats, doctor.
I know a little bit
So,
about this topic.
I hear you. So let me ask you this though. So when thinking about this further, right? Thinking about stereotype threat, what are some of the things that you're coaching people through in terms of like preparing them for these types of exams or preparing them for life in terms of like, all right, well, here's the things that you need to do in order to overcome it.
All right. So there's a few things. So, and some of it can be done on an individual level. Some of it has to be done on a systemic level, right? So the very first thing I do is educate people on stereotype threat. I present on this topic probably 6-7 times a year. I'm at different conferences presenting on this topic. I go to organization, like anybody who wants me to come and talk to them, I will come and talk to them on this topic, because teaching people about stereotype threat reduces their personal impact of stereotype threat. Because once they understand the phenomenon, when they have the increased anxiety, they're like, oh, okay, that's just my stereotype threat kicking in, et cetera, et cetera. So that helps to alleviate it. So that's the first thing. The second thing I tell anyone is, the second someone says, oh, I'm not a good test taker or anything like that, go get a therapist, who is skilled at doing test anxiety. Like just immediately, just go get a therapist and have them help you with your test taking anxiety, because that's all that is. So that also helps. The other thing too is promoting what we call like a growth mindset, which is a lot of times if you have a fixed mindset, you're looking at tests like, okay, this is proof of how intelligent I am, or this is proof of how prepared I am in this field, or if I'm good enough, et cetera, et cetera. When you teach growth mindset, what you're teaching is, okay, this is nothing but a snapshot of where I am, but if I study more, I will get better. So this isn't a proof of whether or not I'm good or not, or acceptable or not. This is just a snapshot of where I am currently. And the more time I spend on task, preparing and learning, the better I'll do on the exam. If you have a growth mindset, StereoType Threat affects you way less. That's the first thing. You have better psychosocial adjustment across the board, and people who have a growth mindset have higher overall GPAs and higher career aspirations. So I teach individuals to have growth mindset, and I even incorporate it in my therapy, and when I'm supervising other social workers, I always find ways to incorporate growth mindset into the sessions. So that's stuff you can do on the individual level. Systemically, first off, demographic information should not be collected at the time of the exam, right? You got to collect it way in advance. That's the first thing. Second thing is we need to have a lot more representation. So, for example, if you're going to apply to a school, I always tell people how many people who look like you attend that school. You do not want to be the only one in the room. You do not want to be one of the only few in the room, because if you do that, you would now are putting yourself in a situation where you basically become a racial ambassador, whether you mean to or not. So we know that once you hit a critical mass in a room, StereoType Threat gets reduced. So when you're looking at colleges, I'm like, if it's 5-10%, why are you even applying to this school? Why are you going there?
Bro, so wait a minute.
I said what I said. The
I know
data backs it up.
I understand that. I understand that, right? But then also our life experiences and the things that we've done education wise our lived experiences does not support the research, right? So like we're anomalies in the sense that we went through PWIs or whatever and like we came out on top. But there's a lot of people that go to PWIs and they don't come out on top because of StereoType Threat and the things that you're mentioning. I just wanted to just put that out there like this. So there are some folks that experience success.
There's folks who experience success, but how many people who who didn't experience success?
I know a lot of people that have
experienced success if they were in a more supportive environment.
Yeah. So I can tell you because at my HBCU, I feel like the major differences was that like if you weren't in class, there was somebody following up like, yo, where's this person at? Or asking somebody that knew you like, yo, what's up with such and such, make sure you get them this message or whatever. And if they had to pull up, then they would pull up. I just don't think that same level of care is going to happen at an R1 or a PWI or whatever. Like if you don't show up to class, they're still going to get paid. They're still going to teach their lesson, and you're not even going to be a thought to them. Is some of the thinking for some people. I'm not going to say I'm not going to like broad stroke it, but I'm thinking I'm safe in saying that for most.
Right. But the other thing too is whatever your experience was at at HBCU, you want, and it doesn't have to be HBCU. It could be a PWI that has representation. Georgia State, for example, graduates more African Americans than any school in America, like numerically. So it's really about the number. It's really about the representation, right?
Yeah.
When you are not worried about, I
was at the National Treasure.
Say what?
I was at the National Treasure. Yeah. The Morgan State University. Just put that out there. Right? Like, we're not at R1 status yet. However, it's coming.
I mean, these rankings are. I mean, don't get me started on that.
No, I'm a school snob. So
you could be a school snob. Look at how these rankings are determined. Half of the rankings is how your peers think about you and what you think about yourself. That's factored into it. You know what I'm saying? The SAT scores of the people who were admitted factors into your thing. So basically, the more popular your school is, the better rankings you're gonna get.
I don't know that to be true.
Yo, look it
If
up.
you're taking, listen, you and I both know as researchers that you can make research say whatever you needed to say, right?
Can
There's going to
you?
be a study. Yes, there's a study
Can
that
you?
can make that. There's a study that can make you that can make your argument
Right.
prove worthy of conversation, right?
No, no,
Now it'll probably
I'm
be
not talking about studies. I'm talking about
yeah,
the formula that they use to determine the rankings. That's literally part of the factor in higher education.
yeah, but that's
Determine.
also the difference. That's the difference between being a quant and being a qual, right? Like you're talking some quant language right now, and I don't want to hear that, baby. I'm a qual.
You don't want to hear that?
I don't want to hear no
Yo,
quant.
don't take my word for it, man.
No,
Bring up the
no,
USA
I believe you.
Today.
Yeah. No, I believe you. But let me ask you this though, like because you had a couple of schools that during COVID had removed those barriers, right? So they had removed the ACT, SAT, and they were looking at other ways and means in order to help students get into college and adjust. Since they have taken that away, they have put back the barriers of having the SAT and the ACT because they found that by using the other metrics in order to allow students into universities, it just didn't get them the quality of student that they thought that they were going to get.
Yeah. So I'm trying to not sound like how I'm about to sound. So
I need you to sound how you about to sound.
so look, their rationale.
Yeah.
So what happened was this: the high ranked schools, the research, the Ivy Leagues, those high ranking schools, they found that those were issue. So they stopped it, and then all the schools beneath it followed suit.
They
I'm
had to.
sorry. Like half of these schools, I'm like, it don't matter. Like half of these schools, I'm like, show me the data where you say that your students were underperforming, and how are you judging underperforming? Were they passing? Because if they're passing, we straight. It's the same thing.
We could do a whole nother show on that on how
Yeah,
it only takes a 2.0 in order for you to get to.
exactly.
That's
So even
crazy.
like the MCAT score that's needed to get into medical school versus the MCAT score that represents the minimum knowledge you need to successfully pass your whatever
Boards,
the test is for a doctor is like the
boards.
gap is
Yeah,
huge. You're
yeah.
basically using it as a way to exclude people.
Yeah.
So I'm not even with it.
Hey, I know you got a time cut, so I'm gonna put you in your final thought. What's your final thought?
So my final thought is this: it's representation matters. If you are whatever field you are in, mentor people who look like you, especially if there are exams. If you are working with young people, right, you want to make sure that they see people who look like them, that they have mentor groups for people who look like them. When you are administering tests, et cetera, you want to make sure challenge any, like if you see that stereotypes are being taught or normalized, you want to challenge that. You see the gap caused by StereoType Threat performance starts in third grade. Third grade on, you see a performance gap related to StereoType Threat. By the time we're losing hundreds of students. So my thought is, get your computer, get your phone, Google Scholar StereoType Threat, and read about it. And there's so many interventions that we can do to address this issue. But the main thing is just getting people talking about it, because this was discovered in 1996. And every time I do a presentation and I ask people, have you ever heard about this? And these are educators and therapists. If I get more than one or two people in a room of 30, 40, 50 plus raising their hand, I'm shocked. We need to educate ourselves.
Yeah, we got a part 2 of this, bro. But thank you for coming on the pod, man. Super appreciate it.
All right, man. Thanks a lot. Thanks for having me.